Good morning, everyone. As Kathleen mentioned, I am Kathleen Cahill from Health Management Associates, and I'm here it's my pleasure to introduce Dr. Jeffrey Reynoso. Dr. Reynoso is the Director of Region 9 for the U.S. Department of Health and Human Services, and he is the key local representative for U.S. HHS Secretary Becerras. Dr. Reynoso is going to give us an update on health policy developments. Dr. Reynoso?
Good morning, everyone. Buenos dias. As was mentioned, I have the pleasure of serving as regional director, your regional director for the U.S. Department of Health and Human Services. I wanted to just share a little bit about myself and my background and some of how we're structured in our office and some of the priorities that we have at HHS, and looking forward to the conversation in a little bit. So a couple of facts. So I have the pleasure of serving under the administration representing our U.S. HHS Secretary Javier Becerra in the region. We have about 90,000 employees in DC, but also across the country, and with our global health programs around the world. We have a series of firsts at the department that we're really proud about. Having the first Latino Hispanic serving HHS Secretary in U.S. history. We also have our highest ranking trans official in the federal government with Dr. Admiral Levine, who is our Assistant Secretary for Health. And I'm really fortunate to be going to work every day with the most diverse administration and the most diverse leadership team at HHS in history. So a little bit about kind of where I sit in the bureaucracy of the federal government at HHS. We are what we like to call the front door at HHS with all of our various staff and operating divisions. You know, your CMS, your HRSA, your SAMHSA, your ACF, Administration of Children and Families, CDC, FDA, so the whole alphabet soup of HHS related agencies. My department is intergovernmental and external affairs, so we are the main point of contact with our governors, mayors, local representatives, and on the external affairs side, many of you, nonprofits, hospital systems, health plans, advocacy, consumer organizations, et cetera. Talked a little bit about our family of agencies and the great work that they all do, but I'll just skip this slide really quick. So Region 9. Region 9, I'm based in San Francisco. I try to come out here to Arizona quite a bit. I've met some of you, but I haven't met all of you. So I'm gonna stick around throughout the day, and I hope you come and talk to me, and I get to learn more about your organization and your work. The last year that I've been in this position, I've been here probably a dozen times. I know that's not sufficient, but we have a big region to cover. So in addition to California, Arizona, we also have Nevada, Hawaii, the U.S. affiliate Pacific Territories, and very importantly, with the work that we do across our geographic footprint, 157 tribal nations. So that nation-to-nation relationship is really critically important to the work that we do at HHS. I mentioned a little bit about the work that I do as regional director. We have 10 regions across the country. I'll just skip this slide really quick. Okay, so priorities and what we're here to talk about today. And I failed to mention earlier, so this is my first State of Reform conference in Arizona, but not my first State of Reform conference. Prior to starting in this role, I was based in California and have a background of working for community health centers. So that's kind of where I started out my career. Have also worked for a local county health department. So I was a Chief Administrative Officer for the County of San Diego Health and Human Services Agency during the early days of the Affordable Care Act implementation. So setting up our systems, our operating systems, workforce, IT systems for expansion of coverage. One of my priority projects was our justice involved population, so I'm really excited about the work that's happening here in Arizona with that population in particular. And most recently, before starting this role, I worked in Sacramento, focused on state health policy. So, I'm really kind of a policy nerd when it comes to that. I really think that interplay of federal policy with state policy and that interplay with county government and local government is so critically important in how we deliver health care. In terms of HHS priorities, as our secretary often says, healthcare is a right for all and not a privilege for a lucky few. I think we were really fortunate to have the secretary at the helm of when he started at the height of the COVID-19 pandemic, because he really pushed the department to meet the American people where they're at. And I'll talk a little bit about that in my remarks. So primary priority for HHS, and this cuts across all of the work that we do. I think it says there, omnipresent in our work is health equity. And I know that health equity means a lot of things to a lot of different people, but how we think about it at our department is really meeting the diverse communities across the country and meeting their particular needs. Within health equity, with our COVID response, we were able to close those racial and ethnic gaps around vaccine access, and we were really proud of the work that we did with that. Currently, as we're shifting to commercialization with vaccines and treatments, we also don't want to leave anybody behind, so we launched our Bridge Access Program, which is a $1.1 billion public-private partnership for vaccines and treatments, so those that can't afford it still have access to that during this COVID season as well. We've also collaborated really closely on addressing the Black maternal health crisis in this country, so this has been a priority for the Vice President and her office, and I'll share a little bit more in my remarks later about the investments in this space. Very importantly here in Arizona, so I do a lot of travel engagement here in Arizona, and we were, for the first time in history, able to pass advance appropriations. So this is really critically important for our Indian Health Service facilities. When we're having these budget battles, continued resolutions in Congress, it's not going to impact service delivery for our IHS facilities. And very importantly, within the health equity space, a lot of the how we do it at our department is ensuring that we're having the conversation, this two-way conversation with our diverse stakeholders. Just within the last year, we've had the first HHS Black Health Summit in history, the first LGBTQI plus Health Summit in history, the first Hispanic Health Summit in history, and the first Asian Pacific Islander Health Summit in history. So really bringing together a broad range of stakeholders from across the country to DC to have a conversation with our HHS principals and to also hear what those ongoing and unique challenges are in these various communities. So that second bullet point around what we're doing with regards to lowering healthcare costs and increasing accessibility. So a lot happening in this space. I'll save a lot of it for my remarks later. But right now within this space, we're really focused on the effective implementation of the President's Inflation Reduction Act. We like to say at HHS that it should have been called the President's New Prescription Drug Law because so much of what's in the IRA and the Inflation Reduction Act is with regards to lowering costs, particularly in Medicare. So I'll talk a little bit about that in a little bit. But we're also laser focused right now, and I know Arizona is laser focused on this as well with access, is ensuring that those on Medicaid stay on Medicaid if they're eligible under the current Medicaid renewals process. And then also within this space, we are starting our Medicare open enrollment period. So we're trying to get the word out around those Medicare, whether it's traditional or Advantage plans. So we can talk a little bit more about that later. On the behavioral health front, this has been huge priority for us. How do we think about healthcare delivery from a behavioral health and mental health lens, and beef up our mental health and behavioral health systems across the country? It's a priority for the president. It's part of his unity agenda, and we've been able to expand access to mental health, particularly as it relates to crisis response. So 988, we were able to nationalize the 988 hotline number, and I'll share a little bit more about that in the conversation. But also thinking about additional ways to address the opioid crisis in this country. The FDA approved over-the-counter naloxone, so increasing access points. I know that that's something that Arizona has been working on for a couple of years now in expanding access to that, especially for those that are under Medicaid. And then finally, within behavioral health, there's been a large focus around youth mental health. The Surgeon General's report came out, CDC reports, and just the dire state of health for our youth has been really something that has been sobering for us, and we've looked at opportunities to expand access within schools. So I'll talk a little bit about that in terms of some of the policy changes there in the conversation. And then finally, just to close out, around preparedness. I think the COVID-19 pandemic showed us how ill prepared we were in many respects to respond to a crisis like that. And we've been able to, with the support of Congress and the support of the President and Secretary, invest over $30 billion in beefing up our public health preparedness response system across the country, and be able to respond to our annual now trifecta of diseases of COVID, flu, and RSV, and having vaccines available for those that want to participate. Also having more accessibility for states and tribal governments to our strategic national stockpile. And under the secretary, we were able to, this is a little bit bureaucratic, but it actually matters. We were able to transition our ASPR, which is our Assistant Secretary for Preparedness and Response, from a staff division to an operating division. So our department, our office that was focused on pandemic response and emergency response transitioned into an operating division like our CMS, like our Samson HRSA, and so there's additional capabilities there. Stay connected with us. If you scan that QWERTY code there, takes you to our newsletter. We share updates on occasion, and we also want to hear from you. So that's our general email address. If you come and talk to me, I can also share my card and give you my personal email address. So with that, let's start the conversation.
Thank you, Dr. Reynoso. We're going to start off with a series of questions. First question. Commencing in 2023, the first pillar of CMS's 5-year strategic plan is health equity. CMS's health equity strategy builds on the Biden-Harris administration's commitment to advancing racial equity and support for underserved communities. These new health equity advancement opportunities address a bevy of initiatives that support health for all people. But as a focus for today's discussion, we would like to highlight mental health and substance abuse priorities, maternal and child health, and the impact of drug costs on underserved populations. 2 questions. What are some of the notable HHS accomplishments you can tell us about related to those priorities? And the second part of the question, are there any other health equity priorities that HHS is focused on for the remainder of the Biden-Harris administration?
Great. Well, thanks for the question. And it's a big question, so I'll try to tackle it in a few chunks. With relation to mental health challenges and support and how we're thinking about this, Undersecretary, we've invested and doubled down on our support of federally qualified health centers, and in particular in the mental health space. So there are about 1,400 plus around the country, and I think many of you and all of you probably know that FQHCs are in those high need communities where we really need to increase access to a range of services, which include behavioral and mental health. So we have been reinforcing our certified community behavioral health clinic certification, and so ensuring that there's around-the-clock services for those that are in need. I mentioned earlier the investment in 988. To date, over $1 billion of investment across the country. We realize that that's not enough. I think depending on the locality, and have a diversity of states, and once you get within each state, the issue of rural care and rural health is very apparent. There's a patchwork. Previously, there were a patchwork of these 98 these hotline centers, and many of them are nonprofits that just have been struggling. But this investment, the $1 billion plus, has made a difference in increasing staff capacity and increasing services. To date, over 5.5 million calls, texts, and chats have been made into 988. I think that just shows just the enormous need out there, right? And I think what we're really proud about is thinking about health equity, right? It's not its own standalone policy. As we're building out 988, we're also looking at special populations. So we've invested in a tribal 988 program. We have a national pilot project with the Trevor Project. So that hotline is specific to LGBTQ youth. And very recently, we also launched our Spanish chat and text feature. So that was a new addition that we were able to bring live. Not to say that there aren't challenges, and we want to hear those where there are still gaps. But I think Arizona in particular is a little bit ahead of the curve here with the connection point between the hotline to an actual crisis response, mobile crisis response team. And Arizona is one of those models of crisis care, and I think it's one of those models that we need to uplift at a national level. But it's not just about those that are at the point of thoughts of suicide. It's really around prevention. So we're looking at mental health from a prevention lens, and we launched an initiative, and this was a partnership between SAMHSA, our digital service at CMS, to build a new website that's a national resource called findsupport.gov. So that's findsupport.gov. And this is really a one-stop shop. It's consumer friendly, and you're able to, consumers, everyday people are able to kind of guide through common questions as it relates to mental health, where they can find a healthcare professional to kind of meet their needs and what financial resources are available if they need that. I think in addition to that, so the second kind of priority that we talked about is lowering the cost of prescription drugs. Yes. So I mentioned all of the goodies in the Inflation Reduction Act, a couple of them that I think I talk about them all the time to different audiences, a lot of senior groups, and they seem kind of standard because it's almost like this should have always been this way, but it's really, when you take a step back, it's really transformative. So capping the price of insulin to $35 a month, huge for those that we know that there's a crisis of diabetes in this country. And I can't tell you how many stories I've been with the secretary and myself when we hear from a senior on a limited income and they're having to ration that insulin. And so that $35 cap is making a real difference. Secondly, preventative vaccines are now free, no copays, right, under Medicare plan. And this is particularly important for some of those vaccines, even for those that had coverage, like shingles, they were several $100s, and now they're free because they fall under a preventative vaccine. But we know that that's not enough. And something that CMS has been really hard at work at, laser focus, has been the ability that Congress provided through the Inflation Reduction Act for Medicare for the first time in history to actually negotiate drug prices with the drug manufacturers. A couple weeks ago, we announced those first 10 drugs. The drug manufacturers actually agreed to come to the table, the negotiating table, and agree. And if it's good enough for the VA and they've been doing it, why not for Medicare, right? But beyond that, in 2025, one of the provisions that's going to kick in is the $2,000 cap on prescription drugs. So that's going to be another huge benefit for seniors. On the maternal health piece, I talked a little bit about why that's important to us from a health equity perspective. So far, I think in the 2023 budget, something like $471 million was invested in maternal health. And how we're going about it is through different strategies. I would say the first strategy is expansion of postpartum care to 12 months. Arizona is a good job, Arizona. You're one of the states that expanded that benefit. And this is huge, right? I think so far it's been about 35 states. About 500,000 women are receiving access to this expanded benefit. And right here in Arizona, we anticipate about 37,000 people will benefit from this new benefit under access, and that's an increase of 50%. So I think that's going to make a huge impact. We know from the data, it's going to improve outcomes for both the parents, but then also the children. We also have been focused, and this is the intersection with our behavioral health strategy and our maternal health strategy. We launched a postpartum depression campaign, and we've, I think we're trying to have a conversation nationally with to show moms who are struggling that it's okay to seek help. We have a maternal health hotline number that we've invested additional resources in, and as part of that, we're also looking at what is the workforce that needs to be in place to support childbearing women. And so one of those that we've invested in has been increasing access to doula services. So that's been part of our strategy and looking at what's the full range of professions that support maternity care. And we've invested in that through HRSA's Healthy Start initiative. And I think the final point I'll make, and then I know we have some more questions. I'm looking at the time.
I know.
So I'm going to go to the next question. I'm going to save some of the health workforce investments that we made.
How will HHS engage states, local governments, and CBOs to make sure that we receive accurate information and resources to mitigate the impact of Medicaid disenrollment?
Yeah, this is a huge priority for us. I talked a little bit about the Medicaid renewal process. We're tracking it very closely. My colleagues at CMS have been in conversations with all states, and we really appreciate the partnership of Access here in Arizona, and really looking at systems and ensuring that those systems are improved. And, I think that's been a commitment, and that partnership has been, I think, very fruitful because there are system improvements that I think need to be made so that those that are eligible remain on coverage. I think just to answer the question with a finer point, we really think that it's going to take an all of government, but then also all of society approach to solving the coverage issue with Medicaid renewals. Within our office at Region 9, we are developing new partnerships that we really didn't have before with our Housing of Urban Development and working with their grantees to get the word out around Medicaid renewals. We're also developing partnerships, have developed partnership with USDA and all of their food assistance programs. So if you're going in for food assistance. You're also getting information around Medicaid and Medicaid renewals, right? And also Social Security Administration. So we're working on it from Medicaid renewals, but also some of these other programs. So Medicare open enrollment, the federal and the state health exchange programs, so subsidies and marketplace, exactly. But we need everyone's help. It's not just us that we feel are responsible. We think it's a shared, responsibility, and so we want to partner with you all. CMS has developed a host of toolkits that community-based organizations, provider groups can share out with their members, and some of those are adaptable, and the messaging can be adapted to kind of local needs and local communities. And we're also open to hearing feedback if there's additional resources that we need to develop to spread the word. We're also open to hearing those ideas. And then I want to share in this space where we've been trying to do better at HHS, at CMS, and across our various agencies is related to language access. So we know that
I was going to ask you that.
Yeah, so with related to language access, and I know Arizona is a very diverse state. Language access is important here as it is in other parts of the country. We learned a lot at the department through the COVID-19 response in terms of what are those tried and true strategies that we need to be investing in to increase language access. And it really has been that partnership with community-based organizations who are the trusted messengers. We provided millions of dollars in investments in grants to support that outreach, but it's also some of the work that we needed to do internally as a department. So HHS revised its language access plan, and we've appointed a language access coordinator to really look across the board what those gaps are as it relates to how we communicate with the public. Some of those, I would say, noteworthy efforts have been with HRSA. They have a translation toolkit that's widely available, and Medicare, CMS has actually tailored, culturally tailored Medicare information for diverse communities in dozens of languages, and those are freely available. So that's been kind of a shining star. We've also collaborated with community representatives in the development of those materials. So I think that's part of the piece. We can't develop it kind of in a silo as government, but really working with our trusted community-based organizations and actual consumers to provide feedback on those materials that we're sharing out. Our federal agencies are actively at work in increasing language access. I mentioned the language coordinator role, but we also have looked at additional policies. So in May, HHS highlighted some efforts to improve language assistance for those with limited English proficiency. And so we updated some of those plans, and those are available as well. And this is all part of an ecosystem of the administration. Day one, we launched the Advancing Racial Equity in Government. So it's part of that, and there was a follow-up executive order on further advancing racial equity in government. So we're really tackling this from an all-of-government approach and an all-HHS approach. Yeah.
And I think that's what it's going to take, and not just an all-government approach, but reaching out to the community such as you are, as HHS is, because that's really where it's going to come from, that grassroots effort. Well, thank you very much.